All right, ladies and gentlemen, I would like to specially welcome you to the Vagina Room Live. My name is Colinton Jemine KJ, and I'm going to be your administrator behind the scene. I would like to officially make welcome Dr. Feed to take over our live session. So, Dr. Feed, over to you, or mute yourself.
I don't know if they can. Okay, good evening, everyone. My name is Dr. Oyemi Adedamola, the founder of Vagina Room. Are we all there? I'm not seeing anyone on the group yet. I'm not seeing anyone. If you are on the group, can you just wave your hand or do something so that I'll know you are there?
All right, just go ahead. Yeah, you can see
Okay.
their comment.
So I'm not seeing anyone. I'm not seeing. Okay, just people are just coming in. Okay, peace. Welcome. All right. Good evening, everyone. My name is Dr. Oyemi Adedamola, the founder of Vagina Room. We'll be talking about vagina as a whole today, and we'll be differentiating between the vagina and the vulva, all right? Because there are misconceptions about the two. And understanding this will help us know how we can treat our vagina. So, vagina is broad, all right? But we are going to narrow it down. And after this class, we are going to take the questions. We have a lot of questions to answer for people that send their questions. So when talking about vaginal health, the most important starting point is the major anatomical myth. Many people use the word vagina to refer to everything down there, but there are actually two distinct areas that require entirely different care. So understanding this will help us know how to treat our vagina. So let's start with the vulva. Vulva is the external or the outer area that you can see. This is the vulva. All right. Then we have the labia. The labia majora is the outer part. The inside part is the labia minora. We are talking about the vulva. Then we have the clitoris. The clitoris is the highly sensitive organ that responds to pleasure. We all know our clitoris, all right? So we have the vaginal, the urethral opening and the vagina opening. But outside this, there are some things we don't know or we are not conversant with, like the sweat gland. There is a sweat gland around this area. If you notice that, you sweat a lot under here. But the sweat gland around this area is called apocrine gland. It's not the usual one in your body. All right. So this sweat gland play a major role in the edge of this vulva. So now we have the apocrine gland are located in some areas in our body. Our armpits, then we have it around the nipple, all right? Then we have it around this area where you have F follicle. Then we have it in our groin area. So now, this sweat that comes out from here produce thick, milky fluid that's initially odorless. Initially, it doesn't have odor, sorry. Initially odorless. But when it's mixed with the skin bacteria, with dirt, it becomes foul odor. It becomes a lot of, in fact, it becomes odor that you cannot stand. So when we're talking about vagina, it starts from here. It starts from taking care of this part of the body and cleaning that sweat gland well. So now, how does this sweat gland affect the vaginal health? Let's start from there. They contribute to the natural stains. Without these, you might not have your own scent. All right. They help to keep the vulva healthy by reducing friction and irritation. Now, they can sometimes cause problem if the gland becomes blocked. So if you have if you sweat a lot around this area and you don't clean properly or you don't wash properly, the hair follicle, we have hair follicle here, we have around this area. If it's not cleaned properly, the hair follicle mixed with the sweat, with the dirt, and gives a foul smell. So now let's talk about the vagina. Vagina is the internal part. I think I'll use this. Vagina is the internal muscular canal. Mind you, vagina is self-cleansing oven. It's naturally maintain an acidic pH of 3.8 to 5.5, 4.5 rather, populated with a beneficial bacteria called lactobacilli. Please, I'm going to mention that often. There is a good bacteria in your vagina called lactobacilli. This bacteria produce lactic acid, which keeps the harmful bacteria away from this area. All right. So when we disrupt the delicate internal chemistry with certain habits, issue like bacterial vaginitis, we call it BV, yeast infection, or urinary tract infection can occur. So let's quickly talk about habits to watch out for that we need to know. One, dutching. Dutching is when you use your finger to remove those bacteria that protect your vagina out, thinking you are helping the vagina. Another way, when you use a wash that has smell, the vagina gets irritated easily when you use something that has odor, that has scent. That can cause irritation and blisters. Those are part of the question they ask. So when you want to clean your vagina, you don't need to clean vagina, you clean the vulva, you clean the parts. This part is where you're supposed to clean because this part is self-cleaning. Now, another way you need to know how to keep your vagina clean is staying in wet or tight clothing. Okay, when you stay in wet and tight clothing, you can trap moisture in your body, and yeast and harmful bacteria thrives in a warm, dark, and damp environment, and that will restrict the airflow and trap the sweat against the vulva, which increase the risk of yeast overgrowth. Everybody have yeast infection. I've been treating yeast infection. It starts from there. When you go back, when you go to the gym and you don't remove the clothes on time, those damp environments, those damp clothes can attract bacteria, and that bacteria can alter the vagina. So now, incorrect wiping techniques is another way another thing we need to watch for. People wipe their vagina this way, from back to the front, when they use the restroom. It is harmful because the anus naturally hosts bacteria like E. coli, and that are perfectly fine in the digestive tract, but highly problematic if introduced to the urinary tract or the vagina opening. And just like indirectly push the bacteria towards the urethra and the vagina opening if you wipe from back forward. So frequently you'll be having UTI, bacteria imbalance if you wipe from back forward. So the right way to wipe is from front to back. Every time you want to wash your body or you are using a wipe or anything, you wipe from front to back. So now, another thing you need to take note this evening is skipping the post-sex bedroom tip. When you skip that part, okay, being sexually active is good, all right? And I know majority of us fall asleep or like to cuddle our partner right after sex without urination. Let me break it down. During sexual activity, we engage in foul play, you understand, and bacteria from the fingernails, from the mouth, depends on the type of foul play we engage in, can easily get pushed upward towards the urethra. And if it's left for a very long time, it results in painful UTI. So when people say, I've been treating urinary tract infection, are you checking your lifestyle? Are you checking what you're actually doing that is wrong? Part of it is not urinating after sexual intercourse. Now, let's make it a rule to pee within 15 minutes after sexual activity. Will help a lot in treating infection or helping our vagina. So another thing we need to talk about this evening is mismanaging period products. I know we live on all life, like I'm very busy. All those business that does not make you to change your pads often can lead to disruption in the vaginal health. So when you neglect the change that you're supposed to have, maybe you forgot your tampon inside that you're supposed to change around 3 to 4 hours, and you left it for 8 hours, that can breed bacteria or disrupt the natural bacteria that is inside your vagina to protect it. So leaving tampon in your body for more than 8 hours can increase the risk of what we call TSS, toxic shock syndrome. And this is a rare threatening bacterial infection that can affect the whole of the vulva, including the vagina. So we should learn to change that regularly. So most importantly, we need to understand that our vagina is self-cleansing. It does not need our help. We just need to make it balanced, like balance all the bacteria that we have there. So there are some things I need us to know this evening, very fast. A healthy vagina is dominated by a good bacteria called lactobacillus. I've said that before. And not all these bacteria are the same. It's not all that is the same. So our microbiome, or okay, I can say let's microbiome in our body. Let me explain microbiome. Is a community of tiny living organisms, including the bacteria, the fungal, the virus, the genital material that lives in our body. That's what we call microbiome. So now, your microbiome, my microbiome actually protects my risk of having infection. All right. And it can also predict my risk of having infection. So I'll break it down to you. See, we have what they call community stage type of vagina, of bacteria. All right. Sorry, of bacteria. So let's assume that we have, let's liken our vagina to a forest. Like when I'm in Asaba they have a forest, and in the forest they have different type of trees. In another place, maybe my community now might have a forest with different type of tree. So let's liken our vagina to a forest. All right. So think of your vagina as a micro ecosystem, just like the way we have different forests that have different kind of trees. So for every healthy vagina, they have a unique mix of bacteria. So that means if you have lactobacillus in your body, it's not just a good bacteria that is strong or has a higher strength. You might have the same bacteria with a lesser strength. So we are not talking about the different strengths in the bacteria. So you know how to take care of your body, or the things you need to take to strengthen those bacteria. So we have CST1. CST1, let's call it bodyguard. So this is community state type 1 among all the bacteria. So let's call it bodyguard. This type of a friendly bacterium. All right. Now let's think about it as the strongest security guard. It keeps your vaginal acidity intact. It lowers the risk of vaginal infection. So that means if you have this kind of bacteria in your vagina, it will stand gidigba. No infection can enter. Do you understand? And it will lower the risk of bacterial vaginosis. It will give you a natural protection. So the second one we have is ST2. CST2. CST2, let's call it peacemaker. It protects the vagina, but not as strong as the CST1. So what does it do? If you have this kind of bacteria in your body, it's a good protection, all right? It protects your vagina, but not as much as a CST1 I told you. But the environment might not be as protected as the way the CST1 will protect your vagina. And all this boils down to what you take in that will make your vagina strong or less effective. So now let's talk about the CST2. CST2 is the flexible protector. Let's think of this as a security guard that adapts easily. It can live in both healthy and changing environments. When women naturally have Some women naturally have issues with this when they have this kind of bacteria in them. Anytime they take antibiotics, it changes the oral, it changes the floral, it changes the vaginal scent or the discharge. So those set of people have CST3 because they adapt. The bacteria, they adapt to anything. So let's talk about CST4. It's a mixed community where we have different bacteria that guide the vagina. So unlike the first three, this one has fewer lactobacillus bacteria and most different kind of bacteria that protect yourself. Then let's talk about the fifth one, which is the last one. I'm talking about different bacteria that we have. It's not just one type of lactobacilli we have in the vagina. We have 5 types. So I'm explaining the 5 types we have so that you understand what you are having and why you are having such bacteria. So now, this type, the fifth one is better because it's comprised of the first four. It's a good natural defense system that you have. If you have such bacteria in your system, it defends your vagina all the time. So you cannot enter somebody's chest and you get infected from there. You cannot. So this bacteria helps to prevent harmful bacteria from around your vulva area and the vagina. So, but there are some things that affect this CST generally in everybody's body. First, your menstrual cycle. Whenever you are menstruating, every of those the menstrual the message that comes out or the blood suppresses the discharge you have there. So those are the things that can actually suppress the CST activities. That's the bacterial activities in your vagina, your menstrual cycle, pregnancy. During pregnancy, a lot of hormones plays out. So there are sometimes some people have hormonal imbalance. When you have that, that can affect the type of vagina type of discharge that comes out from your vagina. Then during sex, after sex, there are changes that is made that allow the or the semen to smell for like 12 to 48 hours or to empower your vaginal health or the discharge for like 12 to 48 hours. So, but what I want us to know in this message now is this: there is no single perfect vagina, or let's say there is no single perfect vaginal microbiome. Every woman is different. But the goal of this class this evening or this lecture is balance, not, not perfection. Friendly bacteria, lactobacilli, helps protect your vagina, but the exact mix you have inside there depends on you, depends on what you take in, depends on the environment you are in, your lifestyle, what kind of product you use. But there's something we need to quickly check this evening. Let's talk about estrogen to run through the questions we have. But I'm giving this background because you need to know yourself. You need to understand yourself. Let's quickly talk about estrogen and the role it plays in our vaginal health. So estrogen feeds the whole system, like the whole vagina, the whole hair is being fed by estrogen. All right. So estrogen, okay, like I said, it feeds the whole system by promoting glycogen storage. What is glycogen storage? We know that now. That's our body storage in form of glucose. That's where sugar is stored. I mean, we have a place on the wall of our vagina that stores glucose. So when the estrogen feeds the whole system, it feeds it by promoting the glycogen system in the vaginal wall. And the lactobacillus, which is the healthy bacteria that is in your vagina, ferments that glycogen and convert it to lactic acid. So that's why the smell that comes out from your vagina smells like, it's not awful like milk. All right. So I just go to there's a question about what kind of smell comes out of the vagina. All right. But I want you to understand how we come about that the secretion that is coming out from your vagina. So this is why microbiome changes noticeably around puberty. You know, when you enter puberty, that's when you start having breasts, that's when people start growing, that's when you start having hair. Those periods, there is a change in your hormone. All right. So at that time, estrogen is active. It's also, you notice estrogen low in estrogen through menopause, all right, as a woman, and when you are breastfeeding. But there's something you need to know. Once estrogen drops in your body, glycogen falls. Then lactobacillus, which is the bacillus, which is the bacteria that protects your vagina, has less fuel, and the pH of the vagina rises. Instead of it to be 3.8 to 4.5, it will rise or be more acidic or tilt toward alkaline. So, and that makes the vagina susceptible to infections. So now, for women, glycogen plays an important role in the vaginal ecosystem. But that does not mean you should take excess sugar. We're going to talk about sugar and your vagina in the course of the class. So, friendly bacteria called lactobacilli use this glycogen as food. Now, when the lactobacilli feeds on this glycogen, they produce lactic acid. I've said that before. And this lactic acid keeps the vagina slightly acidic. Do we get that? So the best thing you need to do for yourself is to avoid dutching. Because when you dutch, you remove the good bacteria. Practice a safe sex, a safe sex activity or a safe sex, all right? Then eat a balanced diet. Oh, it's not just boosting your immune system, your general health. It's also have a role to play in your vaginal health. Then, anytime you feel some smell, we're going to talk about different smells this evening. Anytime you feel different smell or you're feeling uncomfortable, you need to see a health provider. Okay, so let's quickly go through the question we have for now. We'll start with odor. Let's start with vaginal odor. But I just have to go through the foundation so that you understand the type of secretion you have and the reason why you have them. So we're going to do vaginal odor. Somebody is asking about vaginal odor, the smell, and the pH. So let's quickly run through that. Nobody explain why vaginas. They just say, see a doctor. So if you smell bad, you need to listen to this. A healthy vagina has a mild, musky, slight scent. That's the lactic acid that I was talking about when I was giving a foundation for this class. Is completely normal. It's not out of place. And it does not mean anything is wrong with your vagina when you have such smell. It doesn't smell out. You can't even perceive it yourself until you put your hand and take the secretion close to your nose. That's when you perceive just a little, like it's irrelevant because it's not, to me, it's not odor. All right. So when you start perceiving it's upright and you perceive yourself, you should know that odor or that smell is awful. And that you should just look for something that is wrong with you, or just get an advice from any health practitioner. So let's talk about odor. Odor shifts because the pH of your body shifts anytime you're having ovulation, anytime you are menstruating. Okay, let me break it down for you. Your odor shifts with your cycle because the pH shifts with your cycle. So now, around ovulation, there is cervical mucus that increases and can carry a milder scent. Among the questions, somebody asked about ovulation, that she has more secretion during ovulation, which is normal. When you have that, is normal. You just need to know that I am ovulating. Like, it's a fertile window. Your body is telling you something. That's why in one of the classes on YouTube, I said something about your body speaks. That's it speaks. So, and right after your period, your blood is high, it has higher pH than your vagina. Okay. So during your period, the blood temporarily rise the vaginal pH. All right. And this is why the odor is often more noticeable. You don't perceive your vaginal odor during menstruation. You can only be perceiving blood. It's because the blood has higher pH than the vagina. So do we get that? So that does not mean you have infection or you are smelling awful. It's just a change that will not last. All right. So immediately after the menstruation, it comes back to normal. So another thing that happens is this: after sex, I know majority of us don't know this. After sex, especially when you don't use condom, the odor can change from up to 24 to 48 hours. Here is the deeper mechanism. Semen has a higher pH of around 7.1 to 8. That's higher pH than the vagina itself. So now that increase or that difference can temporarily shift the vaginal fluid, all right, or shift the vaginal odor. Do you understand that? So that temporary alkaline shift can wake up like odor producing bacteria, and it's completely normal. So it goes back to normal after 24 hours or 48 hours, depends on your body. So if you perceive a fishy odor, that is a red flag. And because it's fishy odor, that means it's specific. Is the reason why there's a reason why it smells fishy, because bacterial vaginosis has a chemical compound that breaks down proteins. All right. And the chemical compound has or is responsible for fishy smell. So, which is why that smell is specific. Like you can't get it wrong. Whenever you perceive fishy odor or fishy smell, you should know that there's bacterial vaginosis in your system. So now I need you to understand this. I'm still answering some questions. Strong, persistent, fishy odor, especially the one that wasn't after sex, suggests bacterial vaginosis. I hope I'm answering your question. Then, yeasty or bread-like odor with thick white discharge and itching, or sometimes it doesn't. Itching does not come with it. That suggests a yeast infection. Now, foul smell, sometimes described as rotting, rotten egg or rotten smell with yellow green discharge, suggests STI. The word is trichomoniasis. All right. STI is sexually transmitted infection. So when you perceive that rotten smell or you have a yellow greenish discharge. So now, when you have odor in your system, plus fever, plus pelvic pain, or a foreign object sensation, that could indicate a retained tampon in your system or foreign body. So that needs urgent attention. All right. So I've answered the first question and the second one about the vaginal discharge that you need to know. But there's a question here that's asking about the habits that we need to engage in. There are some habits that we need to know. One of it is feminine hygiene. Washes and wipes can disrupt the pH more than people realize. When you use a wash, I have a wash, I clean my body with a wash. Somebody asks if it's normal to use a wash. Yes, but not the scented one. Your vagina does not need help from you because it cleanses itself. You just need to clean the vulva. You need to wash clean with a warm water. I use warm water in the morning if there is no wash. Why? Because remember, the sweat that comes out from here is milky, is thick. It's not the usual sweat that comes out from the body, because the sweat is the sweat that is coming from apocrine gland, and that is thick and is milky. So you need to wash well so that throughout the day you will be clean. And when washing, you need to wash the clitoris. If you open the clitoris, you see dirt there. That's how to wash. But you can't wash by putting a feminine wash that has a nice smell that you want your vagina to smell throughout the day. No, you don't do that. If you do that, you can interrupt the health of the vagina, and that can cause a lot of infection, like a lot different type of infection if it goes on like that. So your wash and your wipe can destroy the pH more than what you can think. So even products that they put, or that is marketed as pH balance or gentle, are still can still trip your protective lipid layer if it's not the good one. I use wash. I have my wash here. I use a wash, and this wash says clean and odorless. I use a natural wash, and which you can actually produce your wash yourself. You can get something natural to wash your body instead of altering the vaginal health. So now, vagina cleanses itself. You just need to wash the vulva. This needs wash. This needs cleansing. That is what you need to know, not the vagina. All right. So let's go to the second, the fourth question here. We're talking about things you need to, okay, yeast infection, recurring infection. I said that yeast infection can be as a result of unhealthy habits. It could be as a result of dutching. It could be as a result of having a longer use of tampon, or what's it called, pads or pint liner. Some people they wear their pint liner from morning till evening, and that pint liner can trap moisture, can trap heat, and that will be against the vulva, and that can create micro environments that some women find incredibly irritating. So somebody said inside in the question that she has vaginal irritation all the time, and especially when she's menstruating or after menses. That means you are holding on to your pint liner or your pads for a very long time. The actual time to change your pads is just 3 to 4 hours. Change them. Even if you have a light flow or you have heavy flow, change. Allow your body to breathe. Allow the flow. Allow the environment to be clean. When you change it often, you will not attract harmful bacteria. It's those harmful bacteria that disrupt the delicate chemistry of the vagina. Do we understand? The another thing that disrupts it is lubricants. I know majority of us use lubricant. Above 40, everybody uses lubricants. That lubricant chemistry matters more than people think. There are many popular lubricants out there that pull out water out of your vaginal cells without even you knowing. And that can damage the epithelial lining that is associated with higher risk of infection and irritation. So if you use lubricants that has a nice odor, I like the smell, that can affect your vaginal health, and that can cause all these bacterial vaginosis, yeast infection, depending on how often you use it. So another thing we need to know is, let's say someone that wears tight, unbreathable synthetic material, those materials that create a warm, more humid environment in your skin can cause or make your body have yeast infection. I'm trying to check this. So create a warm and more humid environment at your skin level, which will favor yeast more than it favors your protective barrier. So when you use a more when you leave your clothes long for a very long time, it will favor the yeast infection. That's why you are talking about yeast infection. It favors it because they like a warm environment, a damp environment. So it will not favor the protective bacteria because the bacteria needs a clean, breathable environment. So the fix is this: never wear leggings for a very long time. When from the talking about when you're from the gym, please remove it so that you not create atmosphere from yeast infection. All right. So I've answered that. Another we need to note here is the toilet paper wiping direction. I've said that before. You wipe from front to the back. You wipe from front to the back, not from back to the front. Because I said that is what they call E. coli. E. coli is the bacteria. It's a leading cause of both urinary tract infection and can contribute to vaginal irritation when introduced from the anus. You know, the bacteria is here. It's good here, but when you wipe this way, it disrupts the health benefit of, it actually disrupts your vagina. That's it. Let's talk about another thing. Pain during sex and sexual wellness. So pain during sex can be as a result of a lot of things. A lot of things. Like, before we go there, I need to make mention of something. There's another one that's talking about vaginal discharge here again. So I think I need to simplify it. When you see a clear, stretchy, egg white like discharge, that means you are ovulating. Number one. Number two, when you see white, thick, lotion-like odorless discharge, that is a normal discharge. Do we get that? Then, when you see a thin, watery, clear, light white discharge, that can occur after exercise, because during exercise a lot of things happen. You understand? You detoxify your body. A lot of blood circulation goes on, so that can give you a liquid like or a thin watery like discharge, or your body is showing that you are in early cycle. All right, that's okay. You are about to have your menstrual cycle. Then when you see a thick white cottage cheese, you know, anytime you see yeast infection, you will know because it looks like cheese. It breaks. So when you see that, you should know that you have yeast infection. And you don't treat with the same thing. If you are treated with antifungi, of course, and you have the same symptoms afterwards, that does not mean you should go to get antifungi again. You need to prep. You need to know why you have it, or check again. It could be another bacteria that has the same symptoms. So when you see that kind of discharge, it shows that you have yeast infection. So when you see a thin gray or white fishy smell like discharge, that means you have bacterial vaginosis. So I'm making emphasis on this because that's what that's the question somebody is asking. All right, I'm answering your question now. So when you see a yellow green with a foul smell discharge, that means you have STI, sexually transmitted infection. Then a brown spots outside period could be that your body is clearing up after period. But if it persists with pain, that's why I needed to take this now. With pain during sexual intercourse or before or after, just go for checkup. Let them check what the problem is. All right. So now, the deeper insight here is this: Consistency matters more than a single day snapshot. So your own personal body is your personal baseline. So what is normal for you across a full cycle, that's from day 1 to day 28 or day 1 to 25, depends on your cycle, is the most useful diagnostic tools that you need or that you have. So many women panic at ovulation discharge, thinking they have infection, and they'll be treating the discharge from ovulation, which is wrong. So that's why I'm specifically saying this night, telling you the difference between the ovulation discharge and the what's called now the infection, the discharge that is associated with infection. So now somebody is asking about hygiene, or I've said something about infection risk. Then the vulvar skin, I've attended to that. Painful sex, okay, PID, STI, pelvic pain. Now, the healthy vagina is full of good bacteria. So your goal is not to make the vagina extra clean. I've said that. Is to protect those good bacteria so they can naturally defend you against infection. So when you start having painful sex during sexual intercourse, let's check the lubrication. Are you wet at all? If you are not wet before penetration, you might have painful sexual intercourse. Then at times, if you are not prepared emotionally, if you are not prepared, it's just not that, okay, my husband needs me, I just attend to him. No, you need to prepare yourself so that you can, and apart from the fact that you need to enjoy the sexual intercourse, it's just to make way for the penis to penetrate. So that could cause painful sexual intercourse. Then if you have infection that keeps coming in, that can dry up the lubricant, the lubrication in the vagina, and that can cause painful sexual intercourse. So do we get that? So in that case, you need to support your immune system. A healthy immune system help your body to resist infection by getting enough sleep, exercising regularly, managing stress, because stress too can affect your vaginal health. Stress can cause dryness. Stress can cause a lot of things because of stress hormone. We all know stress hormone cortisol. So that can actually affect or hinder the hormones in your body, especially estrogen. So I think we need to talk about hygiene, okay, products and self-care. There are some things we underrate. Some things we take lightly. One of it is persistent fishy odor, especially after sex. That gives you a signal on its own. You don't need to go for over-the-counter products. You need to go see your doctor or you go for tests. There are some tests that a woman needs to do when you notice a change in your body. One of it is urine MCS, urinalysis. When you go, that can pinpoint the kind of problem you have. For instance, when a woman has when I was talking about the vagina, I'm talking about the bacteria in the vagina. When you have the CS3, for instance, the one that adapts easily, you might be having infection and not seeing all the symptoms. Because I've asked some people who say, "Oh, I don't have this." You ask them this, they don't have it, but they're having infection after perceived odor, or when they come in, when they finish having sex. Anybody that comes to the room that period knows you just finished having sex, you should know something wrong. So you need to know that you need to go for tests. What kind of tests are we talking about? Talking about urine MCS, talking about eye vagina swab. That is wonderful. We call it HVS, where they remove the secretion and test it. And that will show the type of infection you have. And when, because of the sensitivity, that will point out the kind of antibiotics you need or antifungal you need, because we abuse a lot of antibiotics. We take antibiotics when you're supposed to take it, and you take the wrong one, because our body differs. If I'm taking antibiotic, for instance, let's use ciprofloxacin, for instance. If I use it to clear infection, that does not mean it will work for you. If you have abused ciprofloxacin for a very long time, it might not work for that particular infection you are using it. That's why you need to contact a doctor or ask questions. Go for a lab test so that they can do a sensitivity test for you that can pinpoint what the problem is. So let's talk about pain during sexual intercourse. Is part of the things they're talking about here. Any pain during sexual intercourse that is new or worsen should be checked. Please do all these tests I just mentioned. Something is wrong. It's not normal for you to have painful sexual intercourse. Then, recurrent infection. Somebody mentioned about a recurrent infection. When you have, for instance, 3 yeast infection or 3 bacterial vaginosis episode in a year, this pattern deserve an actual checkup, not repeated self-treatment. Stop treating yourself. Go, let them check, and they will know the actual product to use. All right. Then bleeding during period after sex. That is a no. That is a signal. So you need to go check up for that. So let's talk about the vulva, the skin, the boil. Okay. The other time I was talking about, at the beginning, I was talking about the sweat gland. The sweat gland we have in this area is the apocrine gland, and that produces thick, milky fluid. Now, when you don't clean well, or you use a ash product, for instance, the hair follicle here, because there is hair follicle around this area. We all know that now. You see hair around here, hair around here, hair around here. The hair follicle can mix or tangle with dirt. And when it tangles like that, the sweat, the sweat, which is the milky fluid, mix with it. The moment it's mixed with it, it causes a foul smell. And that smell cannot go without washing, like using a very good product to wash away. So if you keep that for a very long time, it can cause boil, it can cause bumps, and every time you shave, you notice that you have bumps, you have boil. You should exfoliate. When you shave around this area and you notice frequent bumps, you exfoliate. After exfoliating, use oil. You understand? Use oil to rub that particular area, and the bumps goes away. But if the bumps persist, there are some bacteria that comes with boil. A lot of them. There are times anytime you have staph, some people that have staph might have boil, might have genital wax, to show that there is issue in the body. Like I said, your body speaks. You just need to listen to it. So I've answered that. I've answered the vaginal smell, different type of vaginal infection. I've answered that. But there's something we need to know. If you have checked all these possibilities, you know that you are not using hard product to wash your body. You are not touching your body. You are not doing things that is abnormal with the vagina, and you keep having infection, bacterial infection, you are having yeast infection. You need to check your stress level. See, chronic stress may directly reduce the beneficial bacteria, yes, to multiply, which chronic for a very long time, accumulated stress directly with beneficial bacteria discharge, bad odor, itching, and irritation. So if you have checked all the possibilities and you notice that you've done all the things you need to do, hello, I don't know if you are still there. Sorry, I don't know what happened. The network just fluctuates. So we're talking about stress. So apart from stress, poor sleep can affect the hormone that's can actually cause hormonal imbalance. So during sleep, your body repairs a tissue and regulates hormones. So not getting enough can affect your estrogen level, can make the vaginal tissue more sensitive and dry. Talking about dryness, that could cause it. It can also cause inflammation. You wake up in the morning, body is your eyes is swollen. That's inflammation. Not having enough sleep can cause that, and that can also disrupt vaginal health. So reduce your body's ability to fight infection. It can slow down healing after infection, and also increase the livelihood of recurrent vaginal infection. It's not just hello. If you can hear me, can you say hi? I don't know if I'm actually back. I think I'm back. I'm back. So you check your affect high stress can cause sexual desire. When you say, "Oh, I don't like having sex," yes, it can happen. It can reduce natural dryness during sexual intercourse that we talk about. Check every other problems, and you know you are free from them. Check your stress level. Pelvic pain. Stress can actually cause that. It can alter the vaginal health. So make sex uncomfortable or even painful. That stress may generally influence your daily habits. So reduce. I need to talk about this. Very important. When people are stressed, they eat more of sugary things. Like they eat a lot of sugary food, and they will tell you, "I did not eat throughout the day. I only take Coke, for instance. I only take Coke, and that Coke will, and at the end of the day, they will say, I'm having weight while taking Coke. That is what stress can cause in your body. So exercising less can be a problem, all right? When you sleep less can be a problem. Forgetting eating healthy habits too, healthy eating habits can also be a problem. So in all this, I want to go back to the question, please. Is there any question I've not touched? I think I've touched majority of the questions. In all this, your vagina is self-cleansing, all right? And it's your responsibility to make it healthy, balanced, not perfection. It does not need your sanitization. It only needs you to inculcate good habits that can benefit the natural bacteria that is in the vagina. So in conclusion, except we have a question to ask. Oh my God. I think I've answered all the questions. So please, if there's any question I've not answered, I don't know, you can just ask your question if you want to. I think I've talked about all the questions, painful cells, PID, STC, pelvic pain. That can be as a result of stress, can be as a result of bad sleeping habits. It can be as a result of unhealthy bacteria around the vagina. Itching, body sensation can be caused by any of the infections. Anyone can give you itching sensation. It can give you burning sensation and irritation. Irritation most times is as a result of the pads, longer use of pad, menstrual pad, or it can be as a result of, like, it can be a sign of issues in the body. Your body is giving you a signal that I'm no longer comfortable. Something is wrong down there. So I think I've talked about fishy smell, normal vagina smell. Vagina does not have bad odor, please. You need to know that. Then unusual smell. That's when you have issues. Your body signals with a bad smell. I've said that already. Maintaining healthy vaginal balance is important. There are some food you need to know that you can take. Apart from food, there is a good what's it called? Probiotics out there that is very good for the vagina. I have one. I'm not advertising it though, but if you get the original one, it will go a long way. Somebody that is complaining about dryness, this can take care of it. It's a probiotics with a sleepy hen. Very good one. I've used it, and in fact, I'm still using it. This can help your intimate moisture. It can help odor control. It will help balance the pH of the vagina that I'm talking about. It will help yeast balance. There is also yeast in our vagina, but in little quantity. When you take excess sugar, you can actually increase the yeast in the vagina and suppress the good bacteria. So this is healthy. Apart from the fact that it protects your body against harmful bacteria, it's also help in your vaginal health by giving you a flow, like it has a slippery hem, a wet vagina, lubrication in the vagina. But if you want the original one, you can actually contact us to get this. All right, this is good. You can get it anywhere, but just make sure you get the original one. Then, if you want to get a lubricant, get a natural lubricant that is close to the vagina pH of 3.8 to 4.5. Good lubricants, don't buy lubricants because of the smell, please. Don't buy lubricants because of the smell. Buy lubricants because of the importance of it. And there are other things you can use to actually to substitute the lubricants by taking something that naturally makes you wet. All right. So I think I've answered all the questions.
All right, everyone. We want to appreciate you for staying till this time. I think Dr. Feed is having some challenge with her network. If you're still with us live on this live stream, can you just put hi, or I can hear you so that I'm sure that we still have people on the stream while we wait for her to come back. And if you are joining this live stream from YouTube, maybe you stumbled on this live and you're not on our WhatsApp group, you can actually join our WhatsApp group by visiting www.thevaginaroom.com/WhatsApp, and you get to our page where you can register to be a member of our WhatsApp community. The Vagina Room is an exclusive platform for women to gain confidence about themselves. Thank you so much. I can see someone stay with us. Okay. All right, great. So it's a platform that we created to build the confidence of women in their bodies and to take care of your reproductive and intimate health. So several topics will be treated in the course of our conversations. We intend to also have live events in specific locations, hopefully very soon. But we also have um, the Vagina Room Pro version, which is not going to happen live here on YouTube. It will possibly happen on a WhatsApp group, different from the free WhatsApp community. So if you are interested to be part of the Vagina Room closed community, exclusive inner circle community, I think she's back, inner circle community, then we'll be dropping details on how you can be part of the Vagina Room inner circle tribe community, where you will having a more intimate one-on-one conversation with Dr. Feed. So let me bring her back on the stream. She just
Hello,
came back on the
sorry,
stream.
I don't know what is wrong with the network.
So you,
but I don't know if you have any question. Can you please ask so that I can quickly attend to that?
welcome back. All right.
Hello, I don't know if you are
If you have
there.
any further questions, you can actually drop.
Let
Yeah,
me
we
know
can hear
if
you. Can you hear
are
me?
there.
Yeah, can you hear me, ma? Can you hear me, ma?
There's the back end. I don't know if it's still.
Hello, ma, can you hear me?
I just don't understand why. Sorry, let me check their questions. I don't know. I don't know why the
Ma, can you
network
hear
went
me?
off. Hello. So I'm seeing comments like it's glitching. They can't hear me.
Oh, ma, can you hear me? Hello, ma,
Yes, it's
can you hear
on.
me?
Hello. I'm
All
just
right.
trying to
Yeah, can you hear
be
me?
sure. I want to go check the questions
So,
out. If there's any other question aside the one I just read. So sorry, everyone. I don't know what is happening with the network, but we've discussed in details what vagina is, what good discharge looks like, what bad discharge looks like. Then we talked extensively on different infection, so that when you see a reaction in your body or when you see a discharge in your body, you will be able to, okay, what vagina wash can you recommend? I recommend a vagina that is natural, a vaginal wash that is natural, a natural one. I have one here. So I don't know if you can see it to buy in your area. This is a good one. All right. Or you just send a message and let's see, we can send it across to you. But if you can see it to buy, I'm not sure this have I'm not sure it has what's it called now? Fake. These products, I'm not sure they faked it now. This is a good product. So ma, please, what products Vagina Wash? I've said that already. I just answered that. All right, I just answered you. I just answered the question now. All right, this is good. This is what I use because it's daily intimate private part wash. It's just to wash the vulva, not the vagina itself. So this is good. So which other question? Please send your question in so that I can attend to you because I don't know if you can hear me. Something is wrong with the network. I'm trying to.
Yeah, we can hear you. We can hear you.
Please, oh God, I don't. Sorry, I don't know what is happening, but just send in your question so that I can attend to it quickly before we call it a day. So we have a group, we have a community where we discuss openly on issues that are affecting our vagina. So I know you've gone through a lot of issues like recurrent vagina infection. In that community, we can actually table it and see where the problem is. All right. So I might not be able to do that now, but I hope I'm able to answer some questions about the vaginal health. But in that community, we can talk. It's going to be, there can be an avenue for consultation where we work together as a family. All right. But it's just that you have to, it attracts a token. And when you register, you can be given a free probiotics, a good probiotics that can help your vaginal health. So I don't know if you are hearing me, but I've attended to this question. Let me see another question before I call it a day. Oh. I'm not really seeing any questions. I think I've attended to all the questions. Questions? Okay. Thank you, everyone. If there's any question you want me to answer again, you can actually call. You can actually send a message now so that I can. So that I can attend to it now. Thank you, everyone. So a quick recap. The healthy vagina has a good bacteria called lactobacillus. So, and that lactobacillus it's so how do I put it now? It's classified into 5 different community state type. So now it depends on your hygiene, your lifestyle, your diet can actually tell you the type of lactobacillus that you have. All right. So I talked about a lot of issue concerning the vaginal health. We talked about sex habits. We talked about mismanaging period products. We talked about a lot of things. So you can just go through it. Okay, how can you get? You can get, oh, okay, I've said this already. Somebody is asking that she joined late. What does good or normal discharge looks like? It looks like a milk because it's from lactic acid. So you can just check what lactic acid look like. It's just musky kind of discharge. That is only when you put it close to your nose that you just perceive like a milky kind of smell. It does not have a bad odor. I said earlier that when you sit and you can perceive your vagina smelling out, that's awful because that smell is not the vagina smell. though everybody have different body odor, but no matter your body odor, you shouldn't perceive your vagina when sitting down. So I think I answered that question. I've answered that. Which other question again? Sorry, I'm trying to check. Okay, another question about, okay, the smell. Yes. We have it. You can actually send a message to the group, then they'll get it across to you. I talked about the smell, like the vagina smell. Okay, let me just take it back because of the person that said she joined late. Okay. A healthy vagina has a mild, musky, slight scent. That is the lactic acid smell or scent, all right? In fact, it's completely normal when you have such, but your odor can shift with your cycle. Some people have 25-day cycle, they have 26-day cycle, 28-day cycle, 30-day cycle. At every point in time in a month, your cycle changes, so your body smell changes. So I said something about ovulation. Around ovulation, because we have a cervix, so the cervical mucus, that's the mucus that comes from the cervix, increase and can carry a milder scent. That does not mean it smells awful. All right. Then, right after your period, the blood has a higher pH, and that can temporarily rises the vaginal pH. That is why you have some odors that are noticeable, which is the blood, not the vagina at that time, because the blood smell will suppress the vagina smell. I've said that. Okay, which other thing you want me to say? Okay, I talked about odor, fishy odor. Fishy odor is a red flag telling you that there is something wrong with the vagina, and that is sending a signal of bacterial vaginosis. All right, so you have to go to the medical personnel to actually do a test, to run a test for you, to be able to pinpoint the type of bacterial infection you have, so as to treat it correctly. Then there are some bad habits that we engage in that can cause recurrent infection. I've said that before. So you can actually check. I even said that in one of the classes on the YouTube. You can check that. So any other question, please? I'm trying to check the questions. So I've answered you. I've answered Grace. I've answered. I'm trying to see if I've not answered your question. I think I've answered your question. Okay, let me go through the warning signs. Warning sign that needs a physician attention. When you have a sore, a blisters, or a lesion around your vulva. You remember I said this. When you have a blister around here, or you have a sore, or you have a lesion, that means you need to see a doctor. When you have a discharge that is yellow, green, gray, that means you need to see a doctor. When you have a persistent fishy odor, especially the one that worsens after sex, I've said that before, that means you need to see a physician. When you have itching or burning sensation severe enough to disrupt your sleep or your daily life, you need to see a physician. When you have pain during sex that is new or worsen after some time, you need to see a physician. So there are some tests that is required for all this. A test that can pinpoint the type of bacteria you have. Then another thing I need to know this evening is this. When you run a test for a particular infection and you are being treated by a physician, you need to run another test to be sure that your body is clear of that infection. Another thing you need to know is you need to treat your husband whenever you have infection, any type of infection. Treat your partner. It could be your spouse. It could be your boyfriend. You need to treat it. Okay, another thing says do. Okay, this question, we can actually discuss this question in that's why we have a community. I might not be able to tell you this now, but okay, let me just read the question out. My husband and I stay apart. Anytime we come home and have sex, I do experience vulvar swollen and severe itching. What can I do? Are you having pain? Are you dry? If not, you need to check for infection. You might be part of the people that when they have infection, it does not show. The symptoms does not show, but it could cause irritation, smell from within after sexual intercourse, during sexual intercourse, or that swollen you are complaining about. So I'm not saying he has infection. I'm just saying check yourself of infection so that you can both treat yourself. But all these questions can be answered in the community, all right, in the group class, where we can talk about sex. We can talk about how best to have sex, or how best to enjoy sex, or how best to take care of your body, or how well you can take care of your vagina. Then we'll talk about fertility in the class. I have a class like that on fertility, so you know how to, in fact, the hormonal profile will be discussed, where you know the difference between the estrogen, the progesterone, the prolactin, and the normal amount you need to have. That means you have infection. The person that just asked a question down, ma, I perceive my vagina while sitting down. You have an infection, but the type of infection needs to be known. So you need to go for urine MCS. You need to go for vaginal swab, that's HVS, or you do a blood culture. That will tell you the type of infection you have, and you need to treat it immediately. And this time, you need to treat with your husband or your spouse. Do you understand? If you can perceive yourself while sitting down, there is an issue down there. So I think I've attended to that question. That question. Please, if you have more questions, you can send it to the platform. We'll attend to it. Thank you so much for your time. If you have, I've been able to touch all the questions, but if you are not cleared, you can send a message to me. I will talk to you about it, or you join the community. Community is very good, where you can openly talk about any terminal issue without shame, without confrontation, without anybody knowing that you are the one asking question. And in the group, you have permission to ask for consultation. But without the group, I might not be able to consult you differently. But in the group, I can actually do a consultation, ask you questions, then we'll bring the question to the group to answer in case we have any issues like that. Why having sex? But my partner says he does not. He does. And my doctor prescribed Mycotin. Okay. Your doctor prescribed, your partner said is perceiving. See, I've gone through this before. After sexual intercourse, my spouse, my husband, all right, I'm married, said that, I don't like the odor I'm perceiving today. What happened? Is there anything? And that was due to a change in environment for me. I travel a lot. So when I came back, I think I came with a lot of issues, or maybe a change of environment that altered my vagina smell. At that time, it wasn't awful, but it was not the usual smell is used to. All right, because ordinarily he said he doesn't perceive smell at all. But when he starts noticing smell, he called my attention into it, and I was able to seek for help. I did test. I got the right product to use, and I did a combination therapy. I used a treatment and I used herbs. So if you have issues with that, Mycotin alone cannot remove smell. Okay? Mycotin alone. Mycotin is an insertion. You insert Mycotin here, but the root cause Okay, you start it here. I don't know if you can see me, but the root cause is still there. You need to check what causes the odor, because the odor is coming from within, it's not here. All right. So when you insert Mycotin, except you have an oral prescription or oral product drugs you are using, yes, it can work with Mycotin, but using only Mycotin might not work. And anytime you are done using the Mycotin or any product you are using or any drugs, please go back and test again. Check if the infection has gone, if the smell is still there or not. Okay. Another thing we need to know, if you are given a prescription or a drugs to use for 7 days, please use them for 7 days, because by the 3rd day you might feel relieved, but the problem is still there. So that means you need to use to actually kill the bad bacteria. And anytime you are using, why I love people to complete their treatment is this. When you are treating with antibiotics, remember, you are killing the good and the bad odor. You are killing the good and the bad bacteria. So at that point, you need a booster. You need something to boost your system. You need a immune booster. You need probiotics. All right, so that you can actually multiply the good bacteria. Okay, I've answered this question. Cysts make the vagina smell. It depends. It depends on the. Or it depends. Now, how can I perceive? I can't perceive my odor. It depends. I said that if you listen to me, I said there are some of the bacteria you have in your body, the good bacteria, the natural bacteria that protect us against infection, that might defend you in such a way that you might not have symptoms, but your partner might perceive the odor during sexual intercourse. So that can happen. It's okay. So I'm not seeing another question. I think we'll call it a day. So if you have any question, you drop it in the group, and you can as well join our community so that you can have access to talk to me directly. Then if you want to get any of the products, original products, of course, that can actually do the good work, like intimacy, moisture, odor control, pH balance, and all that, you can get this. This product is not my product, all right, but it's a good product. Like if you get the original one, we sell the original one at the spa. So this is good that you can always use. But treat yourself before you move into probiotics. Treat yourself before you move to probiotics. You can't be taking probiotics when you have infection, all right? You need to treat yourself, take away any symptoms or the root cause of the infection before you take probiotics. I hope you get that, please. Remember to check yourself. If you have any issues, go to the community and send us a message. I'll be there waiting for you. Thank you for your time, and I'll see you another time. I remain Dr. Awuyemi Adedamola, the founder of Vagina Room. Anything at all that has to do with your vagina, no, I got you. All right? You can always talk to me or join the group. Thank you.